20 questions, only true fans get them all, let's go. What does House shoot in his office? A. A medical dummy, B. His computer monitor. C. A brick wall, and D. A corpse to test a theory. The answer is a corpse to test a theory. House fires a Jayu and at a corpse in the morgue to test a theory about a patient's wound trajectory, demonstrating his willingness to break rules for answers. What is Foreman's medical specialty? A. Pulmonology, B. Internal medicine. C. Psychiatry, D. Neurology. The answer is neurology. Foreman is a neurologist who often serves as House's second-in-command, eventually becoming the most House-like member of the team. What is House's signature diagnostic method? A. Prescribing antibiotics first, B. Immediate surgery recommendations. C. Direct patient interviews only, D. Differential diagnosis with his team. The answer is differential diagnosis with his team. House's approach involves gathering his team to brainstorm multiple possible diagnoses on a whiteboard before determining the correct one through elimination and testing. How does House typically avoid clinic duty? A. Leaving the hospital, B. Hiding or making excuses to Cuddy. C. Faking medical emergencies, D. Bribing other doctors. The answer is hiding or making excuses to Cuddy. House constantly tries to evade his mandatory clinic hours through various schemes, leading to ongoing conflict with Cuddy, who enforces his contractual obligations. Who is Dr. Nolan? A. House's psychiatrist at Mayfield, B. House's parole officer. C. House's medical school professor, D. House's rival diagnostician. The answer is House's psychiatrist at Mayfield. Dr. Nolan treats House at Mayfield Psychiatric Hospital, helping him confront his addiction and mental health issues after his hallucinations. Where is Chase from? A. South Africa, B. New Zealand. C. England, D. Australia. The answer is Australia. Chase is Australian, the son of a renowned rheumatologist, and initially joined House's team partly due to his father's influence. What causes House's hallucinations in Season 5? A. Poisoning from a case, B. Schizophrenia onset. C. Brain tumor, D. Vicodin and lack of sleep. The answer is Vicodin and lack of sleep. House hallucinates sleeping with Cuddy and other events due to Vicodin abuse combined with sleep deprivation, leading to his commitment to Mayfield Psychiatric Hospital. What type of cancer does Wilson treat? A. Only breast cancer, B. All types as an oncologist. C. Only blood cancers, D. Only lung cancer. The answer is all types as an oncologist. Wilson is the head of the Department of Oncology, treating all cancer types and serving as a compassionate contrast to House's cynicism. What causes House's chronic leg pain? A. Muscle infarction in his thigh, B. Car accident injury. C. Gunshot wound, D. Severe burn and injury. The answer is muscle infarction in his thigh. House suffered an infarction in his quadriceps muscle. Stacy authorized removal of dead tissue against his wishes, leaving him with chronic pain and a limp. What is Cameron's specialty? A. Immunology, B. Rheumatology. C. Endocrinology, D. Hematology. The answer is immunology. Cameron is an immunologist who brings empathy and ethical concerns to House's team, often clashing with his methods despite admiring his brilliance. Why is "it's not lupus" a running joke? A. House's mother died of lupus. B. Lupus is always the final diagnosis. C. House specializes in lupus treatment. D. Lupus is suggested but rarely the answer. The answer is, lupus is suggested but rarely the answer. The team frequently considers lupus during differentials because it mimics New York conditions, but it's almost never the actual diagnosis, becoming a series-long joke. Who is Masters? A. Wilson's colleague. B. Cuddy's replacement. C. Hospital board member. D. Medical student on House's team. The answer is medical student on House's team. Martha Masters is a young medical student who joins House's team, notable for her rigid ethics and inability to lie to patients. What was Taub's previous specialty? A. Plastic surgery. B. Orthopedic surgery. C. General surgery. D. Vascular surgery. The answer is plastic surgery. Taub left a lucrative plastic surgery practice to join House's team, seeking more meaningful medical work despite the significant pay cut. How does the series end? A. House becomes hospital administrator. B. House fakes death to be with Wilson. C. House dies in prison. D. House moves to another country. The answer is House fakes death to be with Wilson. House fakes his death in a building fire to avoid prison and spend Wilson's final months with him as Wilson is dying of cancer. What ends House and Cuddy's relationship? A. Cuddy accepts another job. B. House drives car into her house. C. Cuddy marries someone else. D. House relapses on Vicodin. The answer is House drives car into her house. After their breakup, House crashes his car into Cuddy's dining room in a destructive rage, ending a New York possibility of reconciliation and forcing him to flee. What is Stacy Warner's profession? A. Hospital administrator. B. Constitutional lawyer. C. Medical malpractice attorney. D. Prosecutor. The answer is constitutional lawyer. Stacy is a constitutional lawyer who works for the hospital and later returns as a patient's wife, reigniting her complicated history with House. Who is House's best friend throughout the series? A. Eric Foreman. B. James Wilson. C. Lisa Cuddy. D. Robert Chase. The answer is James Wilson. Wilson, the head of oncology, is House's only real friend and confidant, tolerating House's behavior when no one else will throughout the entire series. What is Cuddy's position at the hospital? A. Dean of Medicine and Administrator. B. Director of Nursing. C. Chief of Surgery. D. Head of Cardiology. The answer is Dean of Medicine and Administrator. Cuddy is the Dean of Medicine and Hospital Administrator, constantly balancing House's brilliance against his rule-breaking and liability to the hospital. Why does House use a cane? A. Balance issues from medication. B. Gift from his mentor. C. Fashion statement and intimidation. D. Chronic pain from muscle death. The answer is chronic pain from muscle death. House's cane compensates for weakness and pain from the infarction that destroyed part of his thigh muscle, a constant physical reminder of his disability. What happens when House is on a bus? A. He drives bus to save patients. B. He gets hit by a bus. C. He witnesses critical event while intoxicated. D. He investigates bus crash victims. The answer is, he witnesses critical event while intoxicated. House struggles to remember events from a bus ride where he was drunk, eventually recalling that Amber was on the bus and died in the subsequent crash. How did you score? Drop it in the comments, and follow for more quizzes.